Okay, good afternoon, everyone, and welcome to the weekly webinar. We're happy to have you here as always. Thank you for joining, and I'm going to stop sharing my screen. There we go. So thank you for being here. As always, please keep yourself on mute so that we can hear our excellent speakers share the great information they have. And if you want to say something, feel free to put your comments in the chat and we'll watch those. And I know that Alicia and Amy will be happy to answer questions. If you need closed captioning, look for the CC at the bottom of your screen and click on that. And then you'll be able to have captions on during our program. And we are recording, so this will be available online tomorrow so that you can watch it again if you like, and or refer anybody that you know who might be interested to watch it. And we know this topic is especially timely and relevant. We're excited to hear what Alicia and Amy have to say. But first, one more announcement, and that is that we are having a Keto Cooking Made Easy demonstration and recipe tasting program next Wednesday, May 31st. So you can wrap up the wonderful month of May with that class. The deadline to register is tomorrow at 4 o'clock. So you have just over 24 hours to get in on that. I will put the link to that in the chat. So if you're interested, feel free to fill that out. So with that said, I am welcoming my colleagues, Alicia McMillan and Amy Wilson, to our webinar today. I want to tell you some great things about them. Alicia is the Memory Care Clinic Engagement Representative, and that means she meets with families to discuss research opportunities and resources from the Alzheimer's Disease Research Center. Alicia has a Bachelor of Science in Behavioral Neuroscience, so you know that means she's awesome at doing her job. Her passion for doing this work stems from her personal experience with her grandmother, who had progressive supranuclear palsy. That's a mouthful. And so that makes Alicia especially well equipped to talk with families about their journeys with dementia. And Alicia thought it was beneficial to create today's webinar about advocating for yourself or for your loved ones or just for the general population. So she's going to give us some great tips, along with our colleague, Amy Wilson, who is the Brain Health Navigator at the KU Alzheimer's Disease Research Center. And Amy has multiple degrees in wellness, education, and nursing, including a master's degree from KU. So here is another person who is very well equipped to give you great information about whatever you need related to the ADRC. Amy also has personal experience. She is a caregiver to her mother, who had Alzheimer's disease, and her father with cancer. Amy currently facilitates one of our caregiver support groups in the Northland. And in her work as Brain Health Navigator, she helps people navigate dementia. And I, for one, can say she's great at that. Amy and I spent the morning out at the Wyandotte Leavenworth Area Agency on Aging SOC Hop, where we were delighted to talk with folks about our great programs and services. So with that said, one more thing about Amy, she has been a longtime volunteer for the Alzheimer's Association, especially on the Walk to End Alzheimer's Planning Committee. So wealth of resources, both Amy and Alicia. So with that, I'm going to turn it over to them. Again, use the chat if you have comments or questions, and thank you, Alicia and Amy.
Thank you, Kelly, for that introduction, and thank you everyone for being here today. I'm going to first just share my screen here. All right, so as Kelly mentioned, my name is Alicia, and I will be going over the first part of our presentation today, and we're going to be talking about how to advocate for yourself or for a loved one who is experiencing memory changes. So I first just wanted to give a very quick outline of some of the things that I will be speaking about today. So we're going to go over who you should talk to about memory concerns for yourself or for your loved one. When should you go to talk to that physician? What should you expect? What testing should you expect? What should you bring with you to those visits? How exactly should you discuss your concerns? What questions should you ask? And then Amy will take over and talk about what to do if you still feel unheard or dismissed by any provider after doing all the things that I'm speaking about today. So the first thing that I'm going to talk about is who should I talk to about my or my loved one's memory concerns? And the simple answer is whoever you feel comfortable with. We understand that this is a very personal issue and a very potentially uncomfortable issue to bring up. So go to whoever you feel most comfortable with first, and they should be able to initiate that process. But if you're still unsure of who should you go to, I would say that a primary care physician is a very good place to start. And there's a couple of different reasons for that. The first reason is that they have known you for many years, more than likely. So they have information on your health and on the medications that you're on and your personal habits, as well as just personal information, who your family members are, things like that. And primary care physicians should be able to give you a baseline assessment of your memory using one of the many different memory screens or memory tests that there are. Just to name a couple, they have kind of silly names. They have names like the MoCA or the SLUMS or the MMSC, and there's too many of them for me to possibly list today, so we're not going to get into it any further than that. But those memory assessments, that baseline assessment, can be used by your primary care physician to start potentially treating or even giving you a diagnosis for your memory concerns. However, if your concerns are particularly complex, or if perhaps your primary care physician is not as familiar, not as comfortable diagnosing or treating memory concerns, perhaps they will ask for some assistance. They might say, hey, can you go see a specialist? I'm going to go ahead and refer you to a specialist. Some of those specialists might include a neurologist or a geriatrician or a neuropsychologist. And those specialists will be able to do more in-depth testing with you. I want to make a note, however, really quickly, that those specialists that I mentioned, neurologists, neuropsychologists, are fairly hard to come by, and they often have long waits or are already past their patient capacity and might not be able to see you right away. So that's one more reason why, if you have a concern, we suggest that you advocate those concerns for you or your loved one to your primary care physician so that that process can at least get started and they can help get a referral to those specialists. So when should I talk to someone about the concerns that I'm having or that my loved one is having? And it's really whenever you notice a concern. As soon as you notice that there's been a change, I would recommend going immediately and reaching out to whichever physician you do feel comfortable with and getting that process started. And just keep in mind that the risk of dementia increases as you age. So if you're over the age of 65 and you have Medicare, a Medicare annual wellness visit is a very good place to start, as Medicare annual wellness visits include a very short memory screen as part of their procedures. So that memory screen can be used as that baseline that I was mentioning earlier. And depending upon the results of that memory screen, your provider can then say, hey, I think you should meet with a specialist, or hey, I think we need some more testing to be done. But before I move on to what those additional tests might be, I wanted to really quickly just mention that if you don't have an upcoming visit with your primary care physician or an annual wellness visit coming up, it's already passed or it's many months in the future, don't wait for that. Go ahead and still reach out to your physician or their nurse or whoever you feel comfortable with and get that process started as soon as possible. So you've reached out and you've got everything set up. What can you expect at these visits? The first thing that you can expect is that diagnosing the cause of memory changes or memory concerns in general is very complicated. You more than likely are going to have multiple visits with multiple doctors. And they're going to have you do quite a few different things. So some of the things that they're going to do is they're going to really dig into your medical history and dig specifically into your concern and what's surrounding that concern and what's happened recently and things like that. They're probably going to ask you to do more in-depth cognitive testing than is provided in the Medicare annual wellness visit. These tests can take 20-ish minutes all the way up to a couple of hours, just depending upon how in-depth the testing that they do is and who is administering the tests. So those neuropsychologists that I mentioned, those specialists, some of their testing can be, like I said, multiple hours long, and that's because they might include things like depression screening. And depression screening is a very important part of the process, as depression itself can kind of mimic memory changes. So if you get a depression screening done as part of this process and it shows that maybe there's some depression happening, then that's something that your primary care physician or whoever you're seeing can follow up on and start treating right away. And you might be able to see some positive changes just from getting that in place. So it's really important to get that started. Another thing that they're going to have you do is a physical exam. So they're going to check to see if there's any physical signs. You might be familiar with Parkinson's disease and the tremors in the hands that they often will look for. So that's just one of the many things that they will look for in a physical exam that might be a sign of a neurodegenerative process. They're going to have you do some laboratory testing, more than likely. And there's quite a few different ways they do this. They'll do blood draws. They might have you do a skin biopsy. They might do a cerebral spinal fluid, just whatever they think that they particularly need to see if you have any of the proteins or what are called biomarkers that are a sign of Alzheimer's disease or any of the other dementias. And finally, they might have you do brain imaging. And there's a couple of different ways that they go about doing that. They might have you do an MRI. They might have you do a PET scan. They might have you do a CT scan. It just depends upon your personal health history and, again, what exactly they're looking for. And these brain images can help them see your brain and see if there's any structural changes or see if there's any functional changes. So they're going to look and see if maybe your brain isn't working quite the same way that it was before using all of these different tests. So they're going to take all these tests together, and using all these tests together is when they'll really have a better idea of whether or not you are worried well and or whether or not there might be a neurodegenerative process in play like dementia. So you now know what to expect, but what should you bring with you to your visit? The most important thing is a detailed history of your concern for yourself or your loved one. So what exactly does that look like? I would physically write down, what have you noticed? When did those changes first start happening? Were those changes rapid or were they gradual? Was there a particular event that happened that seems to have sparked it? And has there been anything recently that has happened to their health that maybe could have what we call unmask it, which just means to make it more obvious that there are changes and there's a real concern there. So did you or your loved one have an infection recently? Was there surgery recently? Was there an accident, whether that be a car accident or a fall? Did they have a stroke recently? Just anything that you think, well, now that I think about it, this happened just before. Could that have been something that is attributing to this or contributing to it? Go ahead and write that down and bring all that with you, because the better historian that you are for yourself or for your loved one means that your physician that's trying to help you figure out what's going on has more pieces of the puzzle to put together and figure out what exactly is happening and how to best care for you. The next thing to bring with you is an updated list of medications, both prescription and over the counter. So it can be a physical list if you have them written down somewhere. If you want, you can bring like the bottles for the pills themselves, whatever works best for you. Bring a list of questions with you. And this is going to be very important as you try to figure out what exactly is happening. Ask those questions so that you know what to expect and what's going to happen next. Because again, like I said, it's a very complicated process. And if possible, bring a friend, a family member, a care partner, or just anyone that knows you well and can report on your memory. And I know that sometimes it's not possible for them to physically come with you, but if they're not able to physically come with you, consider using FaceTime or consider calling them and putting them on speakerphone so that they can still attend with you and so that they can provide information about the concerns that you guys have noticed, so they can ask questions that they themselves probably have. They almost definitely will have questions. And so that they can just be a second set of ears so that you don't have to try to remember everything that the physician said to you and they heard it themselves. So you don't have to try to relay all of that. So the next thing I want to discuss is how exactly should you discuss your concern for yourself or for your loved one. And the most important thing is that you're as honest as possible, even if it's uncomfortable. Like I said before, memory changes are highly personal, and we recognize that and we understand that. But it's very, very important for honesty to occur. And a good doctor shouldn't ever judge you, has probably heard it all before, and needs to hear your story, like I said, so that they can figure out what's going on and how they can help you or your loved one. And part of that would be to make sure that you aren't just talking about the physical health that you or your loved one has been in and the cognitive health that they have recently, but also the emotional health that they have. So when you're writing down your history, also write down any recent event that might be particularly stressful for yourself or your loved one. Was there a loss in the family recently? Was there a loss of a job that's particularly upset them, or anything along those lines, anything that may potentially cause depression, or just, again, just for them to be stressed, because those things can mimic memory changes or could aggravate any memory changes that might be happening. And like I said before, depression is treatable. So you could potentially get that started, the treatment of that started, and potentially see some positive changes by being honest about that with your physician. Like I mentioned before, make sure that you specifically let them know, hey, I've had this changed in my medication recently, or I had this medication added recently. Some medications can have negative side effects that pertain to your cognition. They might cause confusion, or interaction of different medications could do that as well. So make sure that you note those so that the physician can look and see if any of those medications are known to do that, or any of those interactions between medications are maybe known to do that, so that that change can be made if needed. And like I said before, ask questions. It's going to be such an important part of this process. So you might be wondering, well, what questions should I be asking? And I'm going to go over just a couple of today, but there are so many more to ask. And that includes questions like, can the symptoms that me or my loved one are experiencing be attributed to other causes, like depression, or like sleep apnea can mimic memory changes? There's a lot of just random conditions that you might not think can mimic memory changes, but they do. So ask, could this be something else potentially? And those tests that you had me perform, what exactly were they measuring? And why did you need to use those tests in particular? Are there any follow-up tests that you think that would be beneficial to determine, is this something that might be caused by dementia or neurodegenerative disease, or could, again, there be a different cause for this? Will I need to see a specialist? Do I need to meet with a neurologist, a neuropsychologist? Who do I need to see? What can I expect in the future, and how can I best prepare for that? And this is both for you if you're experiencing the memory changes and your loved ones. What can I expect? What can they expect? What can we do as a family? Questions like, can I still work? Can I still drive? What changes are going to happen in my life if you are diagnosed? What's going to have to change? And are there any services that you know of that myself and my family can access to help us navigate this new terrain? But remember that you only have so much time with your physician. So prioritize these questions. Write down the ones that are the most important to you and start with those. Get to those first so that if you don't get to them all, and you probably won't, there's going to be hundreds and thousands of questions that you're going to want to ask. But if you prioritize them, then you can ask those other questions that you didn't get to the next time you see your physician, or you can reach out to the physician's nurse or care team. So there's lots of different opportunities to still get those questions asked, even if you don't get them in that initial visit. So I'm going to go ahead and pass it on now to Amy, who's our brain health navigator. And she's going to talk about what to do if you've done all the things that I mentioned today, but you still have concerns. You feel like you aren't being heard, that sort of situation. So Amy, I'll go ahead and pass it off to you.
All right. Thank you, Alicia. So I wanted to talk today about, what can you do or what should you do if, you've brought up your concerns to your physician and either they're dismissive of your concerns, maybe they've done testing and they tell you that you're fine, but you still feel like there's something that's not right and you really haven't gotten an answer. So one of the first things that you should do is to make sure that you did communicate properly and clearly with your healthcare provider. If you maybe missed some of the things that Alicia had mentioned, like you didn't write down everything, all the questions that you had, or the concerns that you've had, the symptoms that you've been noticing, and you get to the doctor and they ask you what's been going on, and then you forget to tell them something. I mean, we can all do that at times. I've been guilty of that myself. And then when I leave the doctor, I'm like, oh yeah, I forgot to tell them about this. So, did you clearly communicate with them? Because poor communication can lead to, poor understanding, and lack of communication and understanding by the patient and your provider can cause unnecessary delays in getting a diagnosis and having your symptoms treated. So kind of like what Alicia said also is that there are other things that could be the cause to your memory changes, such as depression or a stressful event. Maybe your thyroid is out of whack and there's something going on there and it's not regulating properly. Maybe your vitamin B12 level is low. So you want to be able to rule out that there's not other causes first before moving on and doing further testing to see, is it a neurodegenerative process going on? Making sure that you were completely honest. A lot of times talking about or admitting or sometimes even realizing or thinking that maybe I am suffering from depression. A lot of people don't talk about it. And they may not even realize all the signs. So making sure that you're telling them everything that's going on, because maybe you don't think it's depression, but the symptoms that you're having could possibly be, and then you can have your cognition, your cognitive changes, they may improve with treatment. And making sure that after you've talked with your provider, making sure that they demonstrated to you that they heard and understand all of your concerns. And if you feel as though, maybe that those things you've forgotten to talk about something, or they didn't just demonstrate that they understood, what your true concerns are, reach out to their office, to make sure that they have everything they need so that they can adequately assess you and order the proper follow-up. Ask them probing, questions, things like, Alicia said, like, what might this be? Are there other things causing my symptoms? What should I do if my symptoms get worse? So you've had your Medicare annual wellness exam, and they did the cognitive testing and everything looks normal, and so your provider says, there's nothing concerning here right now, and kind of just goes along, but you still are noticing changes and having concerns. Ask them, what do I do if it seems to get worse? And so don't delay in reaching out to your provider. And one of the best ways to reach a provider is through a patient portal. That you can call the office, but oftentimes you play phone tag with the provider's nurse. And it can take a while to get in touch with your provider, and they may also, if they're relaying a message to the provider, there's always a chance that not all of the information is gotten to the provider. So using a patient portal, you can, type out a detailed message that will go directly to your provider. Typically it's a lot faster for them to then respond. You're going to get a response directly from your provider in most cases. And another benefit is that your family or caregivers can even have access to that patient portal. So if you have questions, they can reach out on your behalf. They can, look into your medical records and be able to see what it was that the provider has said and done, if they weren't able to attend an appointment with you. So I highly recommend, using a patient portal to communicate. One of the probably most common ones, here at KU, we use MyChart. That is also the same system that is used through St. Luke's. So if you have multiple providers, if you see, your primary care physician is at St. Luke's and you have a cardiologist or a neurologist that's at KU, they can see each other's records. So that's always helpful too. And then making sure that you talk with your family and friends. Maybe you have a family member or a friend that's kind of gone through a similar situation where they felt like their doctor really wasn't listening to them, and they may have some guidance and be able to support you and help you advocate. So talking with your family and friends, are there to be your support. So lean on them, take advantage of them. Don't be embarrassed that, you're having these symptoms, because it's better to talk about it. And so what if you've done all these things, you followed up with the provider again, and you still feel like you're unheard or dismissed by your provider, like you're not getting anywhere, going nowhere. So, talk to someone at your provider's office, such as directly talking with the provider's nurse, if they have a case manager, if they have a social worker, possibly even going and talking with the practice manager, because they can listen to you and help advocate for, what your concerns are and help you get through to the doctor a little better. And then, another option too, if you're not able to get where you're needing to go with your current provider, is to find another provider, establish care with a new physician or nurse practitioner. You might be able to find somebody that is a better fit for you and your needs. A lot of times people that have memory changes, seeing a geriatrician versus, the family practitioner that they've seen, since they were a kid might be a better option because they're more equipped to handle patients that have memory changes and dementia. There's, some family medicine providers have had some specialized training. Maybe they have gone through other trainings that we offer here at the KU ADRC for providers. And so they're more in tune to patients with memory changes. So those are some, some options. Request a second opinion. If you feel like your doctor has done everything, but you still don't feel like you're getting anywhere, a second opinion, it never hurts. But sometimes, like Alicia said, it's very difficult to get into specialists, these days. There's a lot of healthcare providers. It doesn't matter if it's through KU or, St. Luke's, wherever, here, locally or nationally, there's a shortage of these specialized providers. So you have to, kind of pick and choose who you can see and just never stop advocating. I did want to share, if you have questions and you're needing to try to find another provider, a good resource is the National Institute on Health and Aging. They have a lot of great resources on their website, and I was going to share a link to the website in the chat. I know that we're kind of running over on time a little bit, so I want to go ahead and open it up to any questions for Alicia or I.
Thank you, Amy and Alicia, both of you, for really helpful, practical information. There was a question in the chat from Renee Price, who asks, how can you convince someone to seek help?
That can often be difficult. Providing, educating them that there are things that we can do, that maybe it is a, something that's reversible. Maybe they have an infection, maybe they have low B, maybe their thyroid is out of whack. I mean, there's multitude of things. Maybe they have uncontrolled depression, untreated depression, so that there is help. And the other thing too is that if it were to be a neurodegenerative process that, they're having, there are things that we can do, and the earlier that we start and treat that, the longer, and better quality of life they will have. If they wait, some of the medications that we do have to help with Alzheimer's and dementia, if you wait too long, they're not, they may not be effective. We have donepezil or Aricept that are geared at trying to help slow the process down. Well, if you're waiting and waiting and waiting, you may not be able to then slow that process down anymore through medications.
Great. Well, thank you so much, both of you. I know you've given our audience some good tips for their next doctor's appointment or some things to think about as they care for a loved one. So thank you both. I owe you big. I'll say it in public on the recording. Appreciate your sharing your expertise and your time today. I do want to put up our exit slide since we have a moment for that. Thank all of you for attending today. Appreciate your spending time with us this afternoon. Next week's topic is palliative care. And our speaker is Dr. Dion Haley. So we're in for another treat. The details will be in your next issue of My Alliance, which will come out on Monday morning at 7 o'clock. And we know Monday is a holiday, Memorial Day, but you will still get My Alliance. How about that? What a great gift. You know that you can sleep in on Monday and My Alliance will be there for you waiting with all the great tips, the brain booster, the research information, and the information about our webinar next Thursday, which is June 1st already, amazingly, wow. So stay tuned for that and make sure you get the information you might need in the chat. Notice Amy's put her email address in there. Thank you, Amy. If you want to reach out to her, feel free to send her an email and feel free to contact us through My Alliance. If you need more information, you can see all the ways to do that on the screen. So once again, thank you, everyone. Have a wonderful holiday weekend. And we will see you in your inbox on Monday and on the webinar next Thursday. Bye-bye.
All right. Thank you, Kelly. Bye.
Bye-bye.